Hey, it's Dr. Brandon Taylor from Henderson Wellness Center. Today we want to talk about disc herniations or disc bulges. Let's talk a little about the difference in the two first of all. Disc herniation is very simple. We've all eaten jelly donut. We take that jelly donut and we squeeze it together. Everything oozes out. That's a true disc herniation. A disc bulge is very simple. We take a jelly donut and we squeeze it a little bit and a little bit of the jelly comes out the back. When that little bit of jelly comes out and it has chemicals in them, those chemicals irritate our nerve roots and they make us have pain. Okay? So we want to talk a little bit as a chiropractor today how we treat that. First of all, so we want to go through a very detailed neurological exam. So we go through here in our young man here and we would make sure we check our reflexes side to side. We also would go through when we check muscle tests. For example, I'd ask him to pick his leg up for me as far as he can. Good. And do the same thing on the other side. And we go through muscle tests. And those muscle tests do two things for us. Number one, they determine if we have an injury to the nerve root that's damaging the muscle. If it is, then you may not be a chiropractic patient. We might need to get a neurosurgeon involved or an orthopedic spinal doctor involved. But we'll make sure we check that first. Next thing we do is we check sensation. So we make sure that he can feel what I'm doing here from side to side to make sure there's no nerve damage. Once we determine that he is neurologically intact, we then go through and we would call it Williams flexion exercises or McKenzie exercises. So first thing we do, we say is, can you stand up for me, young man? So he would face this way for us, and the first thing we do is we say, now what we're going to do, Colby, is I want you to tell me when I bend you forward or if I bend you back, if it hurts you in your back or into your leg, okay? So for example, when Mr. Taylor comes in and he says, I have pain down my right leg. So first of all, we want to see if we can localize that pain to your back. Second of all, we want to make sure we can get the pain out of the leg and which direction we need to go to do that. So if you want to bend over and touch your toes for me, sir. Does that cause any pain at all to your leg or to your back? No, sir. Good. So he comes back up for me and then you bend back for me, right? Great. And Mr. Taylor said that by bending backwards, it makes his leg and back feel better. So our next progression is we come here and land your stomach for me, sir. And we want to do a couple easy exercises. And we start off real simple. We'd have him put both arms out in front of him like he's going to do a push-up. He would keep his pelvis on the floor and just push up for me like this, sir. And we want to make sure that we can localize the pain here. Localize the pain to the back. I know nobody wants to go to the doctor and actually have back pain, but we call that centralization. We want to make the disc itself centralized here. If we determine that this is okay, we'll then go up front and we'll get on the spinal decompression table. The spinal decompression table, he lays real simple down, and there are two Velcro straps that go across each side here. And we go ahead and we start putting into a treatment or a pull program for Mrs. Taylor's back. A couple things you need to know about our decompression table. Number one, more research than the other table, we got it. The scientific of the head, what actually does the pulling of the vertebrae, we got it. No one else has what we have. A couple things we want to make sure you understand is that when we start doing the pulling of it, we will go through and determine what your weight is. And we're going to use your body weight plus about 15 to 30 pounds. This is really, really different. I know everyone we call it an inversion table, and I get asked every day at work, I said, Doc, can I use my inversion table at home? And if you're not familiar with an inversion table, it's the machine that you would lay in, and you strap your feet in, and then you turn your body up. And you use your whole body weight, and you put it through the low back. If you have a hot disc, you don't want to do that, okay? You don't want to take 100 or 120 pounds and blow it through your disc, especially if it's herniated or bulging. We want to get you on that table, decompression table, and we can use slow control, pull angles, slow control function to reduce the swelling inflammation on the nerve root. And that's how we treat herniated disc. If you have a question, please call me. I'd love to talk to you about decompression. It's 252-430-8000 or go to our website, HendersonWellnessCenter.com. And on our website, you can click on the link and we have a whole 3 or 4 pages, and it talks a little about the decompression and how it works, if it's covered by insurance, if it's not, and we go from there. Look forward to seeing you. Thank you for taking time to look at that video. Bye-bye.